Welcome to Micromed Education, and today in our PG series we'll discuss our second thing. So the second lecture is based on the short case. So what you will discuss and how it will be proceeded when you will get a bacteriological short case with the FAQs related with that. So like we discussed in our long case, you will be getting a case history. Based on the case history, you have to first understand which system is affected, followed by you have to keep some differential diagnosis, then provide a provisional diagnosis. One should also understand which are the various etiological agent associated with this age-wise or the immunological status. Let's discuss and understand it with the help of one case. So here a 35-year-old farmer who is presented with a swelling over right thigh for 7 days and with pain and fever for 3 days. Now the patient, this swelling was started small, painful nodule which gradually increased in size associated with redness, warmth and throbbing pain. Patient also has low to moderate grade fever with no chills and rigors. There is no history of trauma, insect bite or IM injection at the site. Patient does not have any past history of diabetes, tuberculosis or immunosuppression and no prior similar episodes. A nutrient record plate was also given to this with this history showing this type of colony morphology. Now, when you are getting this type of history and the plate, how will you proceed? So, as we discussed, first we have to understand the system. So, this is the system of, it is a system of skin and subcutaneous tissue. Yes, the system we have fixed. Now, we have to understand the differential diagnosis. So, what are the various differential diagnoses in this condition? So the first one, it's a pyogenic abscess, and the most common organism would be your Staphylococcus aureus. It could be a tuberculous abscess as well, also called as cold abscess. But here the differential points will be, there will be no rubor, tender, color. That's why it is called as cold abscess. A fungal abscess like with sporotrichosis or actinomycosis or even an pyogenic abscess due to nocardia, all this can also be there. So these are our differential diagnosis in this condition or the case where we understood the system, the differential diagnosis and the various etiological agents associated with those differential diagnosis as well as with the provisional diagnosis. So now the provisional diagnosis we stick here is right thigh abscess. Likely etiology is pyogenic. The most common cause is your Staphylococcus aureus. If there is a diffuse swelling, one can also call it as a cellulitis. And when there is a cellulitis, the etiological agents will differ rather than from Staphylococcus aureus. It becomes a group A beta hemolytic streptococci. Now, you understood the case, you understood the system, differential diagnosis and provisional diagnosis. Let's move further. So then one can ask the various questions. So various questions related with this case. What are the commonest organisms causing abscess? What is the difference between cold abscess and pyogenic abscess? Why we aspirate pus instead of swab in such condition? What are the precautions one has to take during this pus culture? How to detect MRS and their clinical implications or the significance? And which empirical antibodies are preferred to treat this case or an abscess. I am not going in detail with the individual answer. You can also check it, and if you want and help, you can also mention in the comment. Now we have discussed with the history, FAQs from the histories. Now you have to advise or ask to describe your slant or plate and describe the growth. So remember one thing, when you want to describe the growth of an organism, you have to stick to certain characteristics, like you have to mention the size, shape, elevation, margin, surface, opacity, consistency, color and other features that is based on the plate or the media. You have to always check for the pigment production, whether it is diffusible or non-diffusible produce, order of that particular organism. These are the various things that one has to remember when they are describing a colony morphology. Don't only mention it is a small colony that is golden yellow, suggestive of Staphylococcus aureus. Don't jump directly to this. Describe in full and mention that it is looks like of a colony of a gram-positive cocci, and based on the color that it is a golden yellow color which is mainly produced by Staphylococcus aureus. So this could be the organism. So you have to go in a systematic way and not directly jump. We all know from the colony we conclude that it is a case of a Staphylococcus aureus from the history and colony. But you cannot jump, you have to describe it thoroughly. So this is how you have to describe various colony. I'm not going in detail and read each and every thing, but these are the things how you have to describe. Then comes the first thing, that the thumb rule is whenever there is any growth, the first thing you have to perform is your gram stain. So as discussed in our long case, the gram stain has to be performed with the help of our controls. The rest of the things we have already discussed. But remember, other than the points that is mentioned in your long case, you have to, in your grams, what you have to mention, that it is not a gram positive cocci. Like you have to mention its grams reaction, GPC, then morphology, whether it's cocci, bacilli, cocobacilli, what is the size of that particular organism, how it is arranged, whether any like spore is present or there is uniform arrangement or capsule is seen. All these things has to be mentioned in your gram stain. The another FAQs that is asked with the gram stain, apart we have discussed in our long case, are classification of the stain and spatial stain with the examples. So now we come to the probable pathogen, that from the history, sample, differential diagnosis, probable diagnosis, colony morphology and gram stain. You know your probable organism. In this case it is a Staphylococcus aureus, but we cannot mention it like that, so we will advise. So what you have to mention, this looks like a probable organism, Staphylococcus aureus, however I want to confirm it by various biochemical tests. So you have to take various biochemical tests. So in this case what we recommend is, first is the catalase test, followed by the coagulase test, that is a slide coagulase, tube coagulase. Mannitol salt agar can be used, even a DNS test if it is available, that can also be used. Rest of the thing we have already discussed with our long case discussion. So after that you have to conclude based on the history, gram stain, colony morphology and various identification methods that this organism is XYZ, whatever is the organism. So thank you so much for your patience listening. Hope this case series of PG case series is interesting, and we'll meet in our next lecture that will be on something else other than the bacteriology.